Hello everyone, this is Dr. O, your deficiency-free survey coach. Today, in this video, we're going to be talking about advanced directives. Advanced directives is a written instruction. It could be living will, it could be durable, power of attorney, that people write and sign when they are in sound mind to direct the way they want to be treated if they are not able to make those decisions any longer. So in advanced directive, we have DNR, do not resuscitate. We have POLST, POLST, which is physician's orders for life-sustaining treatment. And the reason why people sign these advanced directives is to make sure that their choices are respected when they are not capable of making these decisions any longer. Now, sometimes when a patient is admitted to nursing homes or assisted living, they are DNR. Maybe the patient went through surgery and come to nursing home for rehab. And on arrival, maybe they're still under the influence of the drug they receive at the hospital. So at that time, maybe a family member will make the decision for them when they come to nursing home. But if this patient recoups, let's say in 3 months' time, the patient is still there and they're now alert and oriented, we need the social workers to go in and do a mini mental test on the resident. If the resident mini mental test has improved, then we need to reevaluate the patient's advanced directive. So advanced directive has to be re-evaluated every 3 months following the social worker mini mental test, if the mini mental test score is appropriate for reviewing the advanced directive. Now, with advanced directives, we need to have a physician's order on admission saying whether the patient is a full code or a do not resuscitate. Now, this physician's order has to correspond with the care plan, it has to correspond with the MDS, it has to correspond with the social service note. If in your facility you have a system of identifying the patient's advanced directive, you want to make sure that that system is being followed accurately. Some people in some facilities, they put a little dot on the door next to the resident's name. In those days, some people used to wear advanced directive bracelet, or the charts. We have a little dot to identify advanced directives. But the issue with those systems of identification is, let's say the dot on the door. When you move the patient from that room to another room, what do? It has happened. You move a patient who is a DNR to another room. Then you bring a patient who is not a DNR to that bed. And that little dot that still says do not resuscitate is still there. It can get confusing. So please, any system you have in place, make sure it's being accurately adhered to. And make sure that any discrepancies between the physician's order, the MDS, the care plan, the nurse's note, the code status form itself that the patient signs on admission, make sure that everything corresponds. If you do that, then you know that you're in good shape with your advanced directives. Thank you so much for watching this video, and please feel free to join us at www.deficiencyfreesurvey.com. We see you next week.